Hi everyone, hope y'all are doing well, staying dry. My name's Rishav, and together with my fellow associates Jade and Haroon, we've been working with Dr. Saber, Dr. Alambegi, and Tarun on their proposal to improve modern brain stroke treatment through the creation of a novel, magnetic, robotically steerable delivery system for guide wires and catheters. Stemming from our learnings through the Texas Health Catalyst Associate Bootcamp, we conducted competitive analyses and patent research for the team, as we believed that this would allow for the team's innovation to stand out as much as we believed it should. Furthermore, interacting with our mentors, Dan Ledeen, Elisa Maldonado-Holmertz, and Dr. Amadio, has allowed us to gain more invaluable lessons about how the technical innovations can be translated into clinical solutions, be it through the brainstorming process of the innovation itself or through how to navigate FDA regulatory pathways en route to production. In all, this opportunity has allowed us to work with a team working to ensure the patient safety and doctor safety while simultaneously allowing for healthcare costs associated with hospitals to be reduced. And we're grateful for this opportunity to view the intersection of entrepreneurship, engineering, and medicine. I'll now hand it over to Tarun to talk more about the technology.
All right. Hi, everyone. My name is Tarun from Magnetics Medical. Today, I'll be talking to you about our magnetic delivery system for neuroendovascular interventions. First, let's examine the facts. Around 80% of the 8 million cases of ischemic strokes globally are caused by obstructions to a significant blood vessel in the brain. These are known as large or medium vessel occlusions, and every minute counts, as we know, so it's critical to intervene in the so-called golden hour after symptoms begin to minimize the risk of complications. The typical treatment is a mechanical thrombectomy, but this suffers from some notable limitations. First, a surgeon must deploy an extremely flexible, less than 1 millimeter thick guide wire starting from the patient's groin, and under an X-ray, manually push it all the way up to the blockage in the brain. While without active steering, they frequently struggle to get the guide wire to turn as intended at branches along the blood vessels. And this is a huge inefficiency for such a time-sensitive process. Second, as you can see on this image, certain parts of the brain are simply too torturous or even impossible to access without precision steering technology. And any navigation struggles will simply worsen the X-ray radiation the clinicians are subject to. So what is our solution? Our solution is a soft magnetic delivery system that offers many advantages. First, we simply fabricate a low-cost magnetic head that we take and attach to existing delivery bodies, such as commercial guide wires or commercial catheters. Then using our compact actuation platform, we can control the orientation of this magnetic head using an external permanent magnet that is mounted to either a passive or robotic arm, along with a separate motorized insertion mechanism. We decrease radiation exposure for the clinicians by fundamentally improving the efficiency of the treatment and enabling teleoperation of the system for remote interventions. And finally, the enhanced precision offered by magnetic steering allows access even into the most complex vascular bifurcations and conventionally less accessible blood vessels. So first, here is a simple demonstration of our technology where we're using the steering magnet to control the magnetic head's orientation, then a joystick to operate the insertion mechanism. And now from last week, here is an X-ray view of us using a robot-assisted magnetic steering approach to navigate through branches in a realistic vascular phantom. Let's take a look at our market now. There are about 75,000 annual MT procedures in the US where we can deploy this system to significantly decrease the current failure rate because the clot could not be accessed with available equipment. Over the next few years, this area, as well as the robot-assisted field, are going to be growing substantially. And by 2030, we see a total addressable US market of about $3 billion. In the first phase of development, we will deliver a passive arm-mounted magnetic steering interface for seamless integration within existing workflows. The second phase will be a full robotic system capable of remote treatments for any patient located anywhere. We outperform our closest competitors across a broad range of criteria relevant to market adoption, as well as practicality for the surgeon's usage. And now here's our roadmap. We have our IP filed, and with the help of our mentors, we've identified a 510(k) pathway and plan to have FDA approval by 2028. Here is our team with over a decade of experience in surgical robotics and neurointerventions. And here's the value we offer to our key players. And with that, thank you to our mentors for all the help, and thank you for listening.
Thanks, Tarun. Questions from the judges?
Hi, good presentation. I'm wondering if you've done any customer discovery with any clinicians. Are they likely to adopt or?
Yes, we are working with a clinician with us, and the idea is we are going to break into the market with the phase one of the technology, which really fits seamlessly within their existing workflows, then it would really serve as a tool to address the limitations of the current process. And as we expand, we will be branching out into the more advanced phase two that's capable of remote interventions.
Thank you.
How does this system differ from the magnetically guided catheters that are used in the cardiac cath lab?
Yes, so that would be the stereotaxis. That's the most common example, stereotaxis niobe and the Genesis. Those mechanisms suffer from just requiring special infrastructure because of their bulky nature. You need special rooms to operate them with magnetic shielding. And the idea that we are having with our solution is we can seamlessly integrate within the existing infrastructure without needing that much of a capital investment. And it would fundamentally be a tool to solve the existing limitations.
All right, thank you.